Now let's cover the topic of eye injuries, of which there can be a couple of main types. One is an object embedded in the eye, the other is a chemical in the eye. In this case, we're going to be first addressing the object in the eye. In this case, we know that the worker was by a grinding wheel and potentially one of the brushes may have flown off the wheel and embedded in their eye. They're in a great deal of pain. We've gone ahead and assessed for scene safety. Our gloves are on, and also the patient is not suffering from airway breathing or circulation problems at this time, so they're remaining fairly stable. We guided them to a place where they can be sat down carefully and now treated. And here's what we do. We find a cup. It's important to understand that we want to actually get something that goes over the wounded eye so that we don't put any pressure on the object that's embedded in the eye. So here we are. Go ahead and take your hand away. Now can you hold that cup in place? You could also use a Dixie cup or a drinking cup, a styrofoam cup, a coffee cup. Go ahead and let go of the cup side. I'm going to put a bandage around. Let me know if that hurts at all, okay? Now I'm going to go ahead and wrap around this. You can let go. And I'm just going to continue here. I know that's over your eye, but I'll move that in just a second, okay? I'm going to continue to bandage around. And probably just a good couple times. You just want to make sure that the cup is not going to slip. And then once you come back around to the other side, we tuck the access in underneath the bandage as long as it's not putting too much pressure. Or you could always tape it in place. And ideally, we're going to transport this patient via EMS because there's things that we can do en route that might not be able to be done in a private car. Now the patient is packaged and ready to go. And now let's take a look at the other type of eye injury, which is chemical burns. Whether a dry chemical or a liquid chemical, it can cause a great amount of damage to this eye and the mucous membrane of the eye in a relatively short amount of time. So getting the person to a position where we can actually start to dilute the chemical as soon as possible is essential. Now we would like to use a balanced solution as far as pH goes, but if you only have the tap water out of a sink or you have bottled water, drinking water, anything is going to be better than nothing. If it's a dry chemical, we're going to brush as much of the excess off as we can before we begin to dilute it and flush the eye. If it's a liquid, we're just going to begin flushing. A key point here, if it's in one affected eye, we want to go from the inside of the eye and rinse to the outside. We don't want to cross-contaminate eyeballs. We don't want to flush from outside in as it can then run over the bridge of the nose into the non-affected eye. Now we've got chemical exposure to both eyes. Remember that we're going to flush for no less than 20 minutes to dilute this and to bring the solution into a position where it's not causing damage. We're going to transport this person to an emergency room as soon as possible, and we're going to watch for other life-threatening issues. Remember, the chemical that went in the eye could have also gotten into the mouth, nose, or airway, so we don't want to take for granted that this is an isolated injury. So we're going to continue to assess our patient from head to toe, looking for life-threatening situations like airway, breathing, circulation, or shock symptoms, and treat accordingly. And then continue to flush those eyeballs out so that we can get the chemical out and stop the burning from happening.